Hi, everybody. I'm going to call to order the Health and Wellness Subcommittee. It's February 12th, 2026. If we could all stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, justice for all.
Yeah, I think so.
Hi, and thank you guys all for coming today. I know it's a smaller group. I think between sickness and sporting events, that we're just, and, I want to still continually have these meetings on, according to the code that we agreed upon. I think, first off, might as well go around the table again. I think there are, so it's one new person here today. Just introduce yourself, quickly, so we know who's here. I'm
Okay. Thank you. Dave Paul, work vets. I'm a phys ed teacher and also the athletic site supervisor.
I'm Nicole Tomaselli, and I am the school nurse at Wyman.
Allison Raz, school nurse at Holloman.
Hi, I'm Karen Wetherill, and I'm with Rhode Island Healthy Schools Coalition.
Jen Palmer, and I'm a manager for Aramark.
Tim Kane, I'm the director of secondary ed.
Krista Murray, I'm the coordinator for social emotional learning.
And I'm Sean Williams, and I am on the board of school. So thank you all for being here today. Karen, thank you very much for making the time. I know that you had multiple meetings today. I saw sort of in real time kind of how you were setting stuff up. I'm not sure if you want to start with anything.
I mean, maybe just because I know this is somewhat of a difference. We've been together for a few years, but there's new people. But Rhode Island Healthy Schools Coalition is a statewide nonprofit, and we support our public K-12 districts across the state, working very collaboratively with the Department of Ed, the Department of Health, and many other community partners, offering technical assistance on policies. I know in the past the school committee members, and there are federal requirements around a local wellness policy, and now even and then a state law around this committee, and there are some new laws around behavioral health if you are yet familiar with that, and some districts are combining the committees, but just to provide that kind of information to ensure that the local districts are getting that information and are supported. And then also with implementation. So just ideas and information around whether it's grants or evidence-based programs that could be available. So that's what I'm here for.
No, and we're happy you're here. Thank you. So the new business that we have, so do you want to start with the first with item one?
Yeah, I'm sure some of you are probably more aware than I am of this, but I attend monthly the school health advisory committee that RIDE holds, and because I'm part of a grantee for Warwick is for Project Aware as well. So they are offering Health 101 to a lot of the health and wellness committees to go around and kind of help along with implementation policy and whatnot to bring everybody up to speed. So I just added that as an idea for this policy subcommittee, health and wellness committee to see if we were interested in that. Have you been outreached by anybody from DOH or RIDE around this?
Not yet, no.
Okay.
But again, there's been some confusion with my email for the former the person I replaced on this committee. So there's been some email issues. So
yeah.
So it's specifically around health and wellness plans. Then you want to look at those other areas and say, that's why they call it a local wellness policy. Gee, is that something that more we feel we should include? Well, that's not something that's really relevant to our schools. And you can look at some of those other provisions, but you want to make sure that you're in compliance with the federal. And then one final thing I'll say is, especially in your role with SAL, a lot of people who come, more new to these committees might look at the policy and say, I don't understand this. Why are you only talking about food service and
Phys ed.
nutrition and phys ed and physical activity and, after school sports and riding bikes safely to school? How come there's no mention? How could this be a wellness policy and there's no mention of mental health or social emotional health? And it's not because the district doesn't care, obviously, or that there aren't initiatives going on. It's because the federal requirement for a wellness policy comes from the USDA. USDA is the federal agency that manages the school meals program. So this was required way back when it was really to address childhood obesity. So the requirement, and I'll send you an actual document that kind of lets you know what needs to be in this policy, what are the requirements. But it really says at a minimum. It's a wellness policy. A district can add anything else in. This is what you are going to be, and I'll use the word audited on, is that you have these elements to it. And I just did this today, North Smithfield, because they were interested in, well, we might want to add some provisions and some language around SEL and mental health. So I gave them some examples of other districts that have done that. So I could do the same.
Yeah, we
thing.
absolutely, this is why Kristen, and there's also
Is
another,
joining here, yeah.
is here, and also there's another SEL
Yep.
member who's not
Yep.
here, who's coaching a basketball game right now,
Yep.
unfortunately.
But who's gonna be,
But who's gonna be here, is gonna be,
Totally.
and I wanted to include
Yep.
that mental health aspect
Yep.
into this group.
and I would
it's
say
important.
for years now, most committees have had, there's been
Yeah.
school psychologists, there's been absolutely, some committees maybe address more SEL programs and mental health than they are, because they're saying, well, we're doing well with our school meals program. But I just want you to know the policy language, why it's very much focused on those areas of health. It's not addressing the others, but I do think these committees are looking more comprehensively, as I think you should. They're all interconnected.
Yeah, I agree,
Yeah.
100%. So when I was given this task, when I spoke to Ms. Moran and Mr. Ricks, who was planning today, it was a big part of it was obviously I have a huge sports background, and that's going to be, you'll find that out later on in this as I talk. But also to the mental health element. I have a son who has social emotional issues, and we deal with it on an everyday basis. I've spoken to Ms. Murray about it, and I think this is where, to your point, anything that we can add to our policy, anything that we can do to help those kids, anything that we can create within this room, is what we want to do. So that just hearing you say the way that other districts are doing it as well, it kind of validates why we're
Yeah. And I appreciate your explanation, because I do hear about it in mine, but I don't understand like where it doesn't necessarily always show up in those policies, but that's very helpful. All right, so I'm assuming too, after maybe Sam Brins from RIDE and DOH kind of maybe do a little foundation work, that also may bring us back to a policy as well as the assessment to kind of think of other areas that we might enter. Yeah,
I think that's a great idea to start with that.
thank you.
So the next, so
I am pharmacy.
yeah, pharmacy, yeah.
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 You sent that
Yeah, I
to
said
me.
it. So I had been CC'd
Look at
on,
me.
and I, apologize, keep on pointing down there. But the pharmacy policy that's been going around, which I believe there was a meeting today. Karen Carr, were you on the call today too regarding this?
No, the grant,
The grants?
no,
yes.
I've seen the draft. I wasn't able to join.
Okay, I added it because I wasn't actually.
Oh, the pharmacy, well,
Oh.
that's, the 2:00 is really more than that, right? Am I, okay.
You might be right.
So I think that the call was about the URI faculty members that are looking to work with Warwick on a grant opportunity. So it is, have you been involved?
Not recently, but last year, yes. I haven't heard it. I used to get the emails and I stopped getting them.
Right, so it's a little bit different. It came from that. So, Dr. Sarah Amin, who actually is a Warwick,
So that,
she's
yeah.
the
Yeah.
child in Warwick schools. She was the, coach when, Warwick, it was, who was the first school? Hoxie, went to the Farm, and Sea to School Institute. She was the coach for that and got involved. This, and I don't want to speak out of turn, but we should follow up. But this is really another faculty member at URI who was looking. So the title of it is Climate Friendly Healthy School Food Systems, Building an Integrated Measurement and Intervention Platform with Rhode Island Districts. So it's really much more than what had been doing. It's really looking at bringing together like food waste. So I know here too, there's a law, and there's many schools who have now jumped on it, getting reducing the food waste that's in schools. And so teaching, starting at elementary, the students and the faculty about the impact of food waste and how we can reduce that. And then having the kids in the cafeteria have a sorting station so that it turns into compost. And there's not as much that's going to the landfill, and why that's so important, and really looking at this interconnectedness. So I don't know who they were working with. They've met, is it Norwood before? No,
I
I
want
think
to
it's
just
the,
piggyback on, because there's been a lot of conversations that I've had with people within nutrition at URI, SNAP, Farm to Table. There was a program out there between Stephanie, who I had reached out to Sarah. Sarah said, I want you to get in touch with Stephanie. I got in touch with Stephanie and her colleague Maria. They are affiliated through URI Farm Fresh Table, and they wanted to pilot this this program. They found they wanted 2 school districts. The other one is in Woonsocket. And so I met with them several times, and there were these lessons about teaching about the kids healthy nutrition. Part of that would be on reducing food waste. They said, and there was grades 3, 4, and 5, and they would be doing things. There'd be some parts where they would be involved, such as weighing the food, how much waste there is. And then they're gonna have all of these lessons taught in school, and then come back and recheck, like see if there's any reduction in their food waste. I was very willing to take that on, but just being the nurse who's already very, very busy and doesn't get her breaks to begin with, I was like, I don't know I'm physically going to be able to do this. I talked to the phys ed teacher at my school, Claudia Botoff, and she was very enthused to take it on. She said in January she already does her nutrition lesson, so she could implement it. Stephanie and Maria did a really, really good job of kind of setting out these plans. So I know that there was that portion of it where this costs absolutely nothing. If anything, there's like Claudia would be gifted these Amazon cards for participating. There's research. Went through just being a DICO. There was made sure that everything was up, and there was the consent form with it. And so these lessons are taking place, and there is the food reduction. And then there was somewhere in conversations with Stephanie, Maria, and Sarah, then there was conversations where I think you got in, and Hoxie and Norwood, they had been doing some stuff.
Yeah, that's where I got,
Right.
like, I started seeing emails pop up in my inbox from, so my son goes to Oxy. So, and I know what they do there, and it's awesome. My son gets, and he loves vegetables. He's probably the only kid I can say it, but he loves vegetables, and he loves anything that they give. So when they start to do their program and they start to cultivate it, and then they start to put it in little bags, they get very excited. So some of these kids get very excited, come home with these bags, and he had beets for the first time.
They have a garden.
He loved beets.
Like a-
He never had beets before.
Right.
So and then I know Dawn, who I was hoping would be here today as well, could speak with what was going on at
Right.
Norwood, because I know Norwood also was creating the exact.
And I was kind of, like when time was right,
Going to
Wyman
Wyman,
as well, as I wanted to
try to get it to Greenwood, and then try to
Yes.
actually pass it to each individual. So that's the whole point of your point at the beginning of getting all of our elementary schools kind of on board with the same projects and doing the same thing.
And I
So-
think that it started because they went to that institute. So they formed a team, and that's what I said, Sarah, Amin was the coach, and that they
Yeah.
were the two schools, and then it was, and I'm not sure Stephanie and Maria, so I guess I'm not.
But there's a lot
Aware of that.
of, in different entities.
Yeah.
People trying to work together to get the, the same goal, and I'm hoping that we can just, I'm envisioning Finding Nemo where they're trying to tell the little fish to just keep swimming, and together swimming in the same direction, you can
Yes.
make a lot of progress.
Yeah,
And that we're giving all of the elementary school kids the same opportunity
And,
to
yeah,
have these healthy
that's kind of
vegetables.
what I've got from the email. Like again, these emails just started popping up, like where I was being copied on, where there had already been an enormous amount of conversation
Mhm.
prior to me being put on. So that's why, like, this is obviously an open discussion where we're talking about everything that's going on.
Yeah, it sounds like Sarah is a key.
Sarah's-
person
Yes.
on all of these.
Sarah's the
Yes.
key in all
Was
of
she
this.
Yes.
invited? I don't know if
I-
maybe she
I
couldn't.
don't know, because I don't know how the rules work, but
She-
I'd love
She
to.
wasn't, I sent her an email. She was not invited. I did send an email. She was not available.
Okay.
Based on the fact that they had the meeting today too.
That was it too.